And for more on President Biden's handling of the COVID pandemic as cases surge across the country, let's bring in North Carolina Republican Congressman, a member of the House Education and Labor Committee, Greg Murphy. He is also a member of the Doctors Caucus. Congressman, welcome.
Good morning or good afternoon, Mike. I hope you're well.
Thank you, sir. Same to you. Are you convinced the United States Supreme Court will say the Biden administration overreached with these mandates?
I am, Mike, and I thought this all along. You know, I've been actually, as a physician, I've been very much of a proponent of vaccination. I think that's a conversation that individuals need to have between a patient and a doctor, not a citizen and a government. And I think it's massive overreach, which has been the plan of this administration has been since day one. I mean, even they've said, we're not sure this is constitutional, but we're going to push it anyway. And the sad thing is, with so many times that they've had this government overreach, they've created in their own right and in their own regard vaccine hesitancy. So I think it gets thrown out. There's no reason, there's no precedent for this ever being done before.
You're a doctor. How should American families protect their families at this stage?
Well, I think, again, I recommend vaccination. I don't know, if we look at all the stuff that's gone on and occurred because of what we've done during this pandemic, as opposed to the vaccination itself, I think really actually we need to pull back midstream and take a look at things. We're smart, but there's so many times that during this pandemic, people have been isolated away from their families, friends, and church that have led to so much depression and subsequent substance abuse. We've now seen the greatest numbers we've ever seen before in overdoses. I think it's just being smart, taking a deep breath, do what you can, and know that this virus, this particular variant, while more infectious, is a lot less virulent. And so we're seeing the numbers pop up in the hospital. I feel very sorry for my colleagues in the hospital because they've been working tirelessly for 2 years. But fortunately, while they're in the hospital, we have not seen the lethality that we did with previous variants.
Congressman, as a dad, all of my peers are very, very worried about their children and being educated in the classroom. What are your thoughts? What's your message to the teachers' unions in places like Chicago that's talking about leaving the classroom?
Mike, I think our teachers need to do the damn job. I'm sorry to be so forward about that, but that is what their job is, to teach. If other segments of our society can go back to work, our nurses, our doctors, people at work, they can go back also. Teachers want to teach. They want to take care of their children. So they pushed another agenda. And, as you were talking about before with the CDC has lost credibility because it followed what the teachers union wanted to do. No, they need to go back and do their job. It is safe to do it now. They've been vaccinated and boosted. It's time to actually get America back in the classroom.
What about what has happened to our children, many of whom have been out of the classroom for at least a year? What are your concerns about other health risks, such as depression, for kids that have been forced to stay home?
Mike, I'm very concerned about that. In fact, I'm writing a letter, we're sending it out this week to the NIH director to look at what the side effects, the corollary adverse effects have had in the pandemic because of reactions. Our kids, especially those in minority communities or those in marginalized out in rural areas, have been severely adversely affected by being out of the classroom. They've lost a year plus of their education. I'm worried tremendously about that because there's no way that those individuals, those children, can ever catch up.
Congressman, we're running out of time, but you guys passed $1.9 trillion in COVID relief. We're seeing a testing debacle in this country. Do you wonder if the taxpayers got their money's worth?
No, I don't. I think the message and all has been wrong, which is what this institution or this administration has done since day one. Now we had the worried healthy, everybody going and getting 4 or 5 tests a day, which has just really, really put a pressure on our system. I think if individuals are symptomatic or if they're being screened at the hospital, yes. But I think in some regards we've created a hysteria by testing everywhere that honestly just does not need to be occurring.
Congressman Greg Murphy of the great state of North Carolina, thank you so much for your time, sir. Have a great day.
You too, Mike. Take care.
Hi, everyone. I'm Brian Kilmeade. I want you to do me a favor. I want you to click to subscribe to the Fox News YouTube page. This is the only way that I know for sure that you're not going to miss any great commentary, any great news bites, any great interviews coming your way on Fox. You can get it all here on YouTube. So subscribe right now.